Hello, everyone. Good afternoon. Welcome back to another learning webinar session with BioBalance. Today, our wellness expert will talk about the unique nutritional needs of women and share practical tips that can help women find balance amidst the different challenges in every stage of their lives. If you have any questions, simply type it in to the comments section and feel free to submit questions during the presentation. Our speaker today is a resident consultant at BioBalance and is the first Filipino certified in functional medicine by the Institute of Functional Medicine USA. He is also the European double board certified in nutritional medicine and anti-aging medicine. He recently finished his fellowship in integrative medicine in the University of Arizona. Everyone, it is a pleasure to present to you Dr. Stanley Chua.
Hi, thank you, Pat, for the wonderful introduction. First of all, I would like to greet all the mothers out there, an advanced Happy Mother's Day, and for all the viewers and for those that are viewing this later, to all your mothers, I wish you all a very happy Mother's Day, in spite of the current circumstance we are all in. So today we're going to discuss women's health because, of course, in appreciation for our mothers and in appreciation for the women of our lives, we want to take care of them as much as they take care of us. So this topic is especially tuned for the unique needs of women across the different stages of their lives. So why are women unique? No, there are several books that have come out. Like Men Are from Mars, Women Are from Venus, and so many other books purporting how men are vastly different from women, and it's true. I mean, women are definitely more unique than we initially thought. At every stage of their lives, since their birth, they enter puberty and enter menopause. They always have this ever-changing hormones, that encompass their entire lifespan. They have cycles of menstruation, where estrogen rises at one point before progesterone rises at one point. You know, there are a lot more disease. There are many diseases also that are very, very unique to women or are more common to women, especially when you're talking about autoimmune conditions such as rheumatoid arthritis and lupus, which predisposes, just by being a woman, you are actually more likely to have these conditions. The third component of why women are unique, of course, is because they bear children. And fertility is often blamed on a woman's inability to carry a child rather than it being a male factor problem. And so that unique state of pregnancy and trying to conceive is largely a big, about, I would say 80% is all about the woman. You know, women are also unique, especially in this time frame, because they are choosing to bear children much later in life compared to our parents. And then lastly, women are generally worriers compared to men. And this is very unique because women are more, because of that worrying nature, they are generally more attuned to how their body works. And they usually feel even slight symptoms that feel off, and usually will seek to address that. So let's zero in on the most common complaints of women throughout their years. And for this topic, we'll be talking about PMS, or premenstrual syndrome. PMDD means premenstrual dysmorphic disorder. We'll talk a little bit about fertility and preconception counseling, because I am seeing a lot in my practice of women that are unable to conceive or have been having difficulty conceiving. We'll also touch on menopause, which basically every single woman who reaches the age of 50 or 60 will go through. And then lastly, we'll talk about one of the complications of menopause, which is very common, which is osteoporosis and osteopenia. Of course, these are not the only concerns that women have, but throughout my practice in the past 8 to 10 years, these come out more and more often in the past few months, no? And so these are the things that I would like to zero in on for today's topic. So let's define PMS first and PMDD. So PMS basically is a constellation of symptoms that happen around the time of menstruation. All right. So the only difference here with PMDD and PMS is basically PMDD usually uh, occurs with usually happens in people who have already an interference with their lifestyle or with their work and their behavior. So normally most PMS usually you'd see some women have some dysmenorrhea, some headaches, a little bit of nausea, and that's basically it. But once that phase passes, they can basically go back to work or live their life. In people with PMDD, it's a little more severe. So that symptom can be quite debilitating, and so they would often be, often have exaggerated emotions, and they really wouldn't be able to function at school or at work. It's already classified actually as a distinct medical mental disorder. So what are the typical symptoms of your PMS? Well, of course, you have your mood swings, irritability, or some women get depressed, anxiety, outbursts of anger, weight gain, bloating, cramping. For all the women out there who've had some form of symptoms around the time of their menstruation, these are the typical signs and symptoms that you would see. So the reason why PMS or PMDD is so hard to treat or to manage, even for the most experienced of gynecologists and obstetricians, is simply because the cause is not well established. There have been a few proposed causations for PMS or PMDD. The first and most common is serotonin deficiency, right? And the way I would like to think about serotonin deficiency is that, basically this is a deficiency of your happy hormone, right? And it's very typical for some women that when they enter their PMS or during the time that they have their PMS, that they tend to crave a lot of these, more comfort foods. And that would usually raise their own serotonin levels, Um, for some women with PMS that has the serotonin deficiency, the use of the SSRIs, which are a subset of psychiatric medications, can sometimes be prescribed with significant improvement of PMS. Then there are, of course, nutritional causes. So magnesium and calcium deficiencies are also very common as well. And supplementation with magnesium and calcium would often show mild physical and emotional symptom benefit. The other proposed causes are, of course, exaggerated response to normal hormonal fluctuations. So there are some women that are very, very sensitive to their hormones. And so these rapid shifts of estrogen and progesterone throughout the month of their cycle would usually cause their moods to go up or down or become very erratic over time. The fourth proposed mechanism is the increase in endorphins, gamma aminobutyric acid or GABA, and hypoprolactinemia or increased prolactin levels. And so all of these would have to a certain degree, an effect on how the brain perceives the body. At the same time, it also affects the hormonal cascade that your body has to go through. It has been postulated that when a person has had physical abuse in his life, whether it's physical, emotional, or sexual, the risks for having PMS in puberty are increased by twofold. Now, the last one here that they propose is that probably there's a autonomic system dysregulation here that is causing the PMS. So all of these are still, are still in its infancy in terms of really determining what is really causing PMS for a woman. And for most women who are suffering from PMS or PMDD at that, it's really hard to identify exactly why they have it unless you dive deep into their life, how they work, what's happening in school, if they have any trauma, and only then can you really figure out how to manage the PMS and PMDD. So conventionally, what we do with a person who has PMS or PMDD, so the first one, of course, if we have serotonin deficiency, therefore we give an SSRI or a SNRI. Some of these examples are listed there. If they have extreme emotional lability, what you do in some instances they would give anxiolytics just to calm them down, and just to relax them. Of course, PMS, one of the top first medications that most doctors would give is actually to give an OCP or some progesterone at that. And this is a very, very common practice. And it's often seen that when OCPs and your progesterones don't really do much in terms of managing PMS or reducing its severity. It would take a specific type of PMS causation to actually make OCPs and progesterone work. And then lastly is typically we would use some NSAIDs. These are your mefenamic acid, but mostly the NSAIDs are just used for symptom management rather than treating causation and or preventing a future PMS episode. So how do we approach PMS from more like a holistic balance? The first thing, of course, is exercise. Exercise has a very strong correlation has an inverse correlation to PMS. Exercise is great because one, it decreases decreases estrogen levels. Two, decreases your circulating catecholamines. This is your epinephrine, adrenaline. It balances your blood sugar and it elevates your endorphins. Caffeine is another thing. When some women take copious amounts of caffeine during the luteal phase, which is the latter part of their cycle, just when they're about to menstruate, it correlates significantly to the severity of the PMS. So it's actually a very good idea that when you are closer to when you're closer to getting your menstruation, you have to reduce the amount of caffeine you take, or go cold turkey at that, so that your PMS won't be so bad. Higher fiber diets usually help because fiber is something that really helps balance hormones. Alcohol is a good way also to help manage PMS by reducing alcohol. You're able to actually reduce the amount of circulating estrogens or the conversion of your hormones into estrogens in the body. Alcohol increases what's called aromatase in the body, and so that increases conversion of testosterone and DHEA into estrogen. And so you would want to reduce those factors that actually influence or can create an imbalance in hormones. Now, this is quite interesting. Short-term fasting is actually a good idea when you are entering the luteal phase of your cycle, because short-term fasting has been shown to actually increase the relaxation response, that's your parasympathetic activity, in young women. So short-term fasting, it's not like your typical intermittent fasting where it's like 16 hours and 16 hours off and 8 hours on, or even longer. So for short-term fasting, basically you're trying to prepare for a blood test every day of the week for the time that you're about to menstruate. And it's been shown that this can really help to bring your body to a state of to a more relaxed state, and therefore lower your cortisol levels and improve PMS symptoms. Now, what are some supplements that we typically use? So some of my favorites for managing a person with PMS is actually magnesium. And magnesium is it's such a wonderful mineral. It does so many things. It's great for relaxation. It's great to calm you down. It's great for dysmenorrhea. The only thing about magnesium is that you have to be careful because there is a certain dose where you can get major side effects, and the most common of that, of course, would be diarrhea. And so you need to talk to your healthcare practitioner, talk to your doctors, so that you can be guided as to what type of magnesium you need to take, and as well as what doses you need to take. Calcium is also good because they have synergy with magnesium. Vitamin B6 or pyridoxine is actually one of the nutrients you need in order to create serotonin properly. So if you have an inadequacy of vitamin B6 or your or pyridoxine phosphate, you will have generally a lower serotonin level, and you won't make serotonin so well as compared to if you have an adequate level of vitamin B6. Vitamin D or sunshine vitamin is really key because it's actually something that is tied to how mood is regulated. So vitamin D, or better yet, just go out in the sun every morning, helps balance the circadian rhythms of your hormones. So this is something that's really fantastic. Vitamin B1 or your thiamine is also a good supplement, and I find this is great for those that have lethargy when they have their PMS. The other two, the last two here, which is chase tree extract and black cohosh, this is a bit controversial, especially when managing PMS. So it's not always ideal to give these two supplements to a person who has PMS, but in a certain characteristic of a patient, let's say with poor hormonal balance, with amenorrhea, they have irregular cycles. It's worth trying chase tree and black cohosh for these patients who have PMS, all right? But only in that instance where they have irregular cycles. Next, we go to fertility. So, a little known fact is that, women think that, they can bear as many children or their fertility is not affected until they reach about 35. The reality is that actually the fertility of a woman begins to gradually decrease as early as age of 32 and decreases significantly faster after age 37. And at this time, there we don't really have a tool or a way to measure now. Oh, you can only get pregnant until you're 39 or 40. There's no such thing as a tool that can really tell you that your time is up by this time. So as long as you're ovulating and you're menstruating, you can still get pregnant, of course, but the odds of getting pregnant decrease significantly as a woman ages. Now, what are the factors in women that negatively impact fertility? Okay, first is if when they have irregular or absent periods. So it's very important that women understand that fertility requires ovulation, and the absence or irregularity of periods means the cycle of ovulation is also very irregular. So in that case, it's very hard to predict when you should have sexual intercourse, and at the same time, it's also very hard to predict, how to increase that fertility potential of a person. No, if a woman's already had pelvic surgery or tubal ectopic pregnancy, that's also cause for concern because these affect the ovaries. When a woman is also very high in or very low in the body mass index, so if they're either if they're overweight or obese, or they're too thin, that also affects fertility. And even excessive exercise also affects fertility. So a woman's balance in terms of their hormones, in terms of their lifestyle is very key in order to obtain optimal fertility. So as you can see here, if a woman is obese, with a BMI of more than 35, it takes them 2 times longer to conceive a baby compared to a normal weighted woman. If a woman is underweight, less than 19, so these are excessively thin women, it takes them 4 times longer compared to a normal woman. Smoking and alcohol and caffeine, they all reduce fertility, and caffeine reduces fecundity by 45%. Caffeine here, the limit here is around 250 milligram per day. A cup of coffee, standard cup, is around 90 milligrams. So you're talking about if a woman is taking more than 2 cups of coffee per day, then the risks or the risk for infertility is higher. Of course, drug use and any use of solvents are also a problem. So what do we do when I'm asked, okay, can you help me get pregnant, or can you help me, try to conceive because we've been trying for so long and nothing seems to work? So this is what you do, what I would ask my patients to do preliminarily. while I ask them to run a few tests, check for hormones and all of these things. Of course, I ask them to avoid smoking and alcohol intake, no? So because of that reduced risk of fertility. And of course, to limit caffeine to less than 200 milligrams per day. So I tend to limit the coffee the women that I handle take to just about a cup a day maximum, right? And it doesn't matter if it's black or it's 3 in 1, preferably black. But as long as it's just limited to about a cup a day. Of course, to manage their stress. So a lot of women are taking on more jobs, more roles in their lives. And it's not all financially rewarding, but some of them are more personally rewarding. So that is also a factor now into why there's a lot of infertility, right? As much as possible, we want to also reduce toxic exposure. So if you are exposed to, let's say, some endocrine disruptors, let's say like BPA or parabens and whatnot, so things we find in plastic, try to reduce your exposure to that. So things like drinking from a water bottle or one of those water dispensers that's out in the sun the whole day, try to avoid that because the plastic begins to leach into the water, and so that begins to affect endocrine function by releasing BPA. Of course, I want them to always perform safe and appropriate physical activity and exercise practices. So nothing extreme. So I don't ask my patients that are trying to get pregnant to, go run a marathon tomorrow or go do CrossFit, every day of the week or something like that. Nothing very extreme. So you want them to do, really more reasonable, more moderated type of exercises. Nothing that really pumps them up too much. Um, exercise is not just all about preconception. It's also about what happens during pregnancy. And if a woman has a good exercise regimen or has a good practice of exercise as they enter pregnancy, they decrease their risk for gestational diabetes, preeclampsia. Babies are more normal birth weight rather than high birth weight or low birth weight. And you prevent excessive maternal weight gain, which is often a problem in some women that, once they get pregnant and gain so much weight, it seems like it's so impossible for them to go back to their pre-pregnancy weight. So in terms of diet, we want you to eat more foods rich in folate, calcium, iron, and vitamin D. So basically, folates, you can get this from leafy green vegetables, calcium more from bones, sardines, anchovies, for example, iron more from red meat, and then vitamin D is from the sun, of course. We also want you to take enough omega-3s because you're trying to prepare for pregnancy. So I always recommend that, you try to boost up as much of your omega-3s as possible prior to getting pregnant, because this one has a correlation to the quality of the quality of the ovum that your body will produce. Try to limit your sugar intake. Of course, this is quite obvious. And try to make sure that you have enough fiber every day. One of the problems in pregnancy is, of course, constipation. And when a woman is pregnant during constipation, the choices for medications are quite limited. And you try not to give women so much constipation because simply you don't want them to develop hemorrhoids as well. No? So if they develop hemorrhoids, that also becomes a problem. And those hemorrhoids, if they burst, can get infected. Lastly, of course, is to support with adequate protein and caloric intake. No? So this one will be up to your nutritionist to help guide you, because there is a computation here on how much protein you need to take per kilogram of body weight, depending on the goals you have. So what are the typical supplements? Of course, folic acid. So we cannot deny that in trying to conceive, even before you are thinking of trying to conceive, you already need to start on folic acid. This is something that isn't often practiced by most women, because most women will just start taking their folic acid once they are already pregnant, which means you're probably 5 or 6 weeks into your pregnancy already by that time. So it's best to start your folic acid as early as possible, because the neural tube, the brain of the baby, the cell division that happens rapidly during the first few weeks of pregnancy is highly folic acid dependent. And so if you want that child to have the best nutritional outcome possible, folic acid has to be started before you even want to get pregnant. Just the mere thought that you want to get pregnant, you have to start that. Iron is a bit of an optional supplement here. I only use iron really for those that have anemia. And because a lot of women do have anemia because of their regular cycle. So this is something that we need to choose wisely depending on the type of patient we're handling. DHA is also another consideration, simply because this is an omega-3 fatty acid and it's great for neural development and brain development of your baby. The fourth item here is iodine. So typically, why iodine? Because the thyroid's demands are increased during pregnancy. So you don't need a lot of iodine. I'm not saying that you have to take copious amounts of iodine or take it as a supplement. You can actually take it in the form of, let's say, like seaweeds or kelp or any seafoods, because those would have enough iodine already that could support your pregnancy. And lastly is vitamin D, because vitamin D is greatly depleted in a woman who is pregnant. So supporting vitamin D, of course, you are supporting your baby's vitamin D level as well. And so getting adequate levels of vitamin D would encourage, one, stronger bone development for the baby, and number two, will also help the mother in terms of her long-term health. Okay, so that's basically what you do in pregnancy. So even before you want to get pregnant, or even before you get pregnant, you have to start on these interventions so that you can get the maximum outcome possible. Third item on our list is, of course, menopause. So those women who are in their mid 40s to maybe mid 50s are in this part now. And basically, it's a normal part of aging, right? There are, of course, some women that, abruptly had to have menopause because of surgery or cancer or some other medical illness. But the average age of menopause for those that don't undergo surgery is actually around 52 years old, but commonly occurs between the age of 42 and 56. Classically, the definition of menopause is, you have to have not had a menstruation for the past 12 months. And so what are the problems we have with this transitional phase is that, a lot of women experience severe hot flashes, severe night sweats. But contrary to popular belief, actually, hot flashes and night sweats are not as common as most people think. In fact, only about 20% of women really experience hot flashes and night sweats. No, most women do have mild symptoms, like they're just more irritable, a little more hotter, but not really a hot flash. Um, so that's why menopause is a very crucial point. Um, when you're trying to transition, or when you know you're about to transition, so how do you know you're transitioning? Well, one, you have skip cycles. So you're still having your menstruation, but it's getting more erratic. Or as you go to that age of 50, you're getting symptoms. Like you say, oh, I'm feeling unusually warm now than, let's say last year, but it's not necessarily warmer. Or the aircon is full blast already, and you're the only one sweating, but everyone else is cold, So those are the signs that you're starting that transition already. And in some people, the earliest symptom I've noticed is that they start getting insomnia. The sleep starts to change. Their energy starts to drop because they can't sleep anymore. So, and they're still having their menstruation, although erratically, but their sleep patterns have evolved. So what are the certain things that we try to do as a woman goes into this transition, right? So stress management is, of course, top of mind. So one of the reasons why a woman would experience hot flashes, for example, is because of adrenaline rush. No, so when your body has excessive adrenaline, it runs on adrenaline. You always are on the go. You're always stressed. Women that have that personality type tend to have worse hot flashes and worse menopause. It isn't true for all, but most of the ladies that I've managed typically have that type of personality. And so stress management really matters. So managing the HPA axis or the HPG axis through mind-body techniques, meditation, prayer is also good. Music is also a wonderful way to relax. So stress management is a key part of this transition. The second part is, of course, if you haven't been or are not engaging in any form of physical exercise, you need to begin some level of physical activity. And later on, this will go into how you will prevent osteoporosis and osteopenia. So try to avoid also potential xenoestrogens and endocrine disruptors. Like I said, things like plastic, BPA, try to reduce that and try to consume mostly clean organic food if you can, or at least the pesticide-free foods as much as you can. Some tips in terms of diet, take cruciferous vegetables. I think this is the most common recommendation I would give to anyone undergoing menopause, simply because cruciferous vegetables helps you manage hormonal levels. They help you balance your estrogen, your testosterone, and your progesterone levels. And so having enough intake of your cruciferous vegetables is very key. So what I would recommend is that you have to have at least 1 cup of these cruciferous vegetables at least 2 to 3 times a day. If not, you can supplement. There are supplements that contain the active ingredients of cruciferous vegetables that will help in managing those hormonal issues. Again, we go back. Fiber. Fiber, 25 to 30 grams a day is fantastic. And you need to get this because it really will help your ability to eliminate hormones properly. One thing that isn't always discussed in most conventional discussions about menopause is actually about entering into a low glycemic diet or a lower sugar diet. Simply, simply because no one ever really thinks, now, okay, I have to change my diet just so that I can get through menopause. But in some women that have really, really bad menopause and they have really bad diets as well, when they shift to lower glycemic diets, lower sugar diets, their transition becomes much more smoother. And so making sure that the person is eating right, is eating a lower sugar diet, low refined sugar diet, helps them transition much easier, much smoother. I just want to put it out there that my goal here is not to stop the transition. It's actually to make that transition smooth for most women. All women will go through this. We can't stop what nature intends. So we need to also be ensure that there's adequate zinc, and zinc essentially plays a role in endocrine function through metabolism of your hormones, right? So if you have enough zinc, no, I think zinc is very popular now. I think everyone's taking zinc because of COVID. So most women will not have a problem with this at this point. And lastly is to take a moderate amount of alcohol and caffeine. So, alcohol and caffeine are very strongly related to how a woman transitions into menopause. So if you have a woman that takes a lot of alcohol, takes a lot of wine, their transitions into menopause tend to be a little more difficult simply because they have peaks and valleys of hormones. So there's an abrupt drop or an abrupt peak of their hormones because of the effect of alcohol on their hormones. Caffeine, on the other hand, affects adrenaline, as I mentioned earlier. And so if a woman is taking a lot of caffeine, more than 250 milligrams a day, it typically triggers more hot flashes for that woman. So certain things that we can use to help manage the transition more naturally. So like I said, there are supplements like soy isoflavones. So these are your, what do you call this? Sulforaphane, for example. Flax seeds and flaxseed oil are also good options. Evening primrose oil, of course, is the ever popular evening primrose oil. It's good because it gives you a little bit of estrogen. It's great for women that have low estrogen menopause. Black cohosh, chasteberry, dongquai, and kava or Piper methystica. The only one here that is not really hormonally active is kava, in the sense of sex steroids. So black cohosh, chasteberry, and dongquai, basically they are all somehow estrogenic or progesterone-like in nature. So they give you a certain boost to certain hormones. In most menopausal women, when I get a profile for hormones, which includes their progesterone, their FSH, LH, and estrogen, it's actually what tells me what I need to give that woman. For example, I have a woman with low estrogen state only with a high enough progesterone, then it's just about supporting that estrogen by giving some evening primrose oil, for example, um, or in some women that have both low estrogen and low progesterone, then maybe a combination formula with black cohosh and chasteberry extract with dongquai would work. The kava here is really purely a um, symptomatic treatment, no? So we can give it as a sort of like just to relax the woman. Some women are just so emotionally labile that they become very anxious. So kava would be something that would be a very natural form of like an anxiolytic that you can give. So the options here will change depending on the chemical or the hormonal picture of the woman that we are handling. And lastly is to deal with osteoporosis. So literally it means porous bones. And apart from the increased risk of fractures, it's also a leading cause for changes in spine shape. No, so you're seeing a lot of women, especially when they reach 99, 100. They're not as upright as they used to. Their neck sort of like starts to hunch forward, or their back starts to become more twisted to the right or twisted to the left. So those are some of the concerns that we have when women are undergoing osteoporosis or osteopenia. And so we want to prevent that as much as possible. No? And it's not purely on an aesthetic level. It's actually a risk level because more fractures will mean, of course, more surgeries. And at the same time, surgeries do bring about a certain level of risk towards long-term health. So really, we want to reduce the risk for osteoporosis. And the best way to prevent the onset of osteoporosis is not calcium and vitamin D, but actually weight-bearing exercises. I always tell the women that come through my clinic wanting to be managed for osteoporosis that, you know, vitamin D and calcium are basically useless unless you also exercise because you need the bones to be stimulated, which means you need to create a resistance against the bone through exercise. And that's the only way that that calcium is actually driven into the bone properly. So most women take calcium and vitamin D, and they check their bone mineral scans, and nothing changes. That's the reason mostly is that they don't bear enough weight or are not doing any form of weight-bearing exercise, and so their osteoporosis just simply progresses. What do we do in someone who has osteoporosis or osteopenia, or someone who wants to prevent that? Of course, alcohol is again top of mind, but smoking is actually a stronger risk factor for osteoporosis and osteopenia. So it's highly recommended if that woman is still smoking at that age, definitely ask her to stop as soon as possible. We try to, of course, support vitamin D status through dietary intake and safe sun exposure. But of course, a healthy body weight also matters. So it's not about being underweight. It's also not being about overweight. So it's about being of the right weight for that right age. So one of the prevailing theories about why osteoporosis happens is that it's actually an inflammatory process. No, so the bones become porous simply because there's inflammation on the bones itself or on the osteoblasts or osteoclasts. So what happens is that because of that inflammation, the bone is slowly degraded over time. And so one of the main strategies now is to try to adopt an anti-inflammatory diet where you have enough omega-3s, polyphenols, and antioxidant-rich foods in order to prevent inflammation inside the body or to manage that inflammation in the body. We also want to try to reduce the intake of dietary sugars, refined carbs, omega-6 fatty acids, and foods high in these compounds are always causing more inflammation in our body. So if you want to stop osteoporosis, you have to also deal with the dietary aspect, because inflammation does significantly play a role in osteoporosis. It's not just a pure play on calcium or vitamin D, or you don't have enough estrogen, that's why you're osteoporotic. It's actually all of these factors plus inflammation. So what do I ask my patients who have menopause or who have osteoporosis or osteopenia to take? So first thing, of course, is I need to make sure that they have enough calcium, magnesium, enough protein, daily in their food. So for calcium, I recommend at least 1,000 to 1,300 milligrams per day. Vitamin D, at least 2,000 IU per day. And then lastly, I also will require my patients to take vitamin K2. Why vitamin K2, not K1, not K3? Because vitamin K2 is actually a vitamin that helps push the calcium into the bones and prevents the calcium from staying in the arteries. So you need actually enough adequate vitamin K2 in order for that to happen. And again, I must reiterate, supplementation with calcium, vitamin D, and K2 only will work if it's supported by moderate resistance exercises. So make sure that when you're dealing with osteoporosis, whether you are already there or you're trying to hold, just starting to get osteopenia, to already start taking these supplements, plus make sure that there is weight-bearing exercise regularly. Magnesium is also a great mineral because it helps balance calcium and it helps maintain the calcium into the bones as well. So there's less leaching of the calcium from the bone. Now, it's highly recommended that a person should take enough protein. So one of the problems in aging women, especially those that are in their 80s or 90s, is they can't eat enough. They can't get to a point where they're eating enough food anymore because of some digestive disorder, or the stomach isn't just primed to eat more for whatever reason. So a lot of women, when they reach their 80s or their 90s, they're not eating as they used to in their 70s or 60s. And one of the common problems is that one of the things they sacrifice is actually protein intake. And why do you need protein intake? Because bones are only as strong as the muscles that support them. So if your muscles are not strong enough to hold the bones together in the right place, even if you have, correct for osteoporosis and all that, you won't be able to strengthen the bone as well as you should, number one, and you won't be able to also support the joints as well as you should. So making sure that a woman has enough protein, whether it comes from meat, whether it comes from a protein shake or some nutritional alternative, is really key towards managing osteoporosis and osteopenia. So, a lot of women are actually
Hi everyone, we're just having some technical difficulty. We'll be back in a minute.
Are we still live?
Yes, Doc, you can
Hi,
share
yeah.
your
So, yeah,
experience.
so sorry, my internet connection broke up for a second there. So anyway, so that was the end of the presentation actually. And I hope you guys learned something. Maybe Pat, you can share screen the final slide. Yeah. So anyway, so I'm open to taking a few questions if there are any.
All right. Thank you, Dr. Stan. Let me just share my screen. So hold on. So for those who have any questions, please do comment in the comment section or FB Live.
So Pat, I think there are a few questions, no? The first question is, how many days a week strength exercise do you need to do, no? So what I would recommend is that for strength exercise, you need to do it a minimum of about 3 times a week. And make sure that for every week that you exercise, you are hitting each of the major muscle groups at least once a week, right? But I apologize, my internet connection broke for a period of time. I think I'm back on.
Okay. So let's move on to another question. So one viewer asked, "Is it true, doc, that in order to alleviate PCOS, one has to lose weight?"
It depends. If you're already a thin person, there's not much more to lose. But if you have if you are obese, if you're overweight, definitely losing weight is part of that process where you need to address in order to improve the PCOS. Any more questions, Pat?
Yes. So another question, doc. I experience back pain, acne, and mood swings every time I'm about to have my period. How will I know if it is still normal, or when should I see a doctor?
Right. So you see a doctor when if it's already affecting how you function normally, no? So my experience is that most likely you are having some form of PMS happening for in this regard. So if your PMS is already causing you to, let's say, miss work a lot, your medications that you used to take that would handle the pain well are not anymore working, or that you're noticing that the acne does not go away anymore, or there are changes that seem to get worse and worse, it's time that you actually need to see your doctor.
Okay. So there's one viewer who asked, I've suffered from gut infections, which gave me a lot of new food intolerances and triggered autoimmune type reactions. I noticed while dining out, so many Filipinos have food intolerances from common foods. First question, are gut infections an epidemic here in the Philippines? And second question, what are the major causes and how can we avoid them?
So okay, so medyo off topic lang. But yeah, gut infections are very common in the Philippines, simply because I think when you're talking about gut infections here, you're talking about dysbiosis. No, I don't think you're talking about diarrhea per se. So if you're talking about dysbiosis, yes, it's very common in the Philippines. It's not an epidemic, but it's common. Um, yeah. What are the major causes of gut infections? Well, of course, if you're eating, so the major cause of dysbiosis actually is heavy antibiotic use, steroids, poor diet is also another cause. So those are the things that really are the main sort of like the main triggers for causing dysbiosis. Now, if you're talking about gut infections in the sense now, okay, it's protozoal, it's parasitic, it's all about hygiene. So the reason why it happens is because basically the sources of your food are not hygienic. Number one, or two, the way that your food's been cooked isn't hygienic as well. So maybe you're eating raw chicken or raw pork, for instance, things like that.
Okay, next question, Doc. Can birth control cause infertility? What are the side effects of taking birth pills or any contraceptive?
So birth controls and infertility. If there's many ways to use OCPs and birth control. One of those ways to use birth control is that in some instances it's used to actually stop menstruation altogether. Now I've dealt with a few cases where because when they stop their OCPs, their menstruation never comes back. And so it actually can cause fertility if it's used in that way. Now there are OCPs that are used like just to regulate menstruation, so that you have a regular cycle instead of you having very frequent or very long cycles. In that regard, I don't see too much in infertility. But for those that really aim to stop menstruation altogether, infertility does happen. And basically, what are the side effects of taking birth control or contraceptives? Well, the most common side effect is that, of course, since these are more synthetic hormones and they tend to be more stimulatory to the tissues compared to our normally produced hormones, they tend to exaggerate usually breast tenderness. They usually exaggerate PMS, sometimes mood swings in some women. Sometimes OCPs can also cause weight gain and excessive water retention. So these are all things that we consider when it comes to birth control as well.
Okay, so Princess asked, Doc Stan, how many days a week strength exercises?
Yeah,
Is 3 times a week, 30 minutes, leg day, arm day enough?
yeah. So usually at least one day a week where you hit each of the major groups of muscles is usually enough to maintain strength. Now, if you want to gain strength, you need to go up to 2 times a week for each body part, right? So those are sort of like the things that we need to consider in terms of exercise.
Okay, so we have a question from Monica. She asked, what is the recommended form of magnesium and dosage for 55 to 60 years old?
So, I plan to do a webinar on magnesium alone and all the different types of magnesium. So 55 and above. So usually I tend to use one of two forms of magnesium for those in that age group. So I would use either a citrate form or a glycinate form. Glycinate simply because I like it for the relaxation effect. I like it for the calming effect that it gives. The citrate form I like simply because it works better overall for energy compared to a glycinate form. So if you're a little bit more fatigued, a little more tired, citrate forms seem to work better in terms of creating more energy and getting you more up and about.
Okay, I think this is our last question, Ado. So,
Yeah.
how does age affect a woman's ability to have children?
So it's inversely correlated. So the higher the age, the chances for pregnancy are less. So that's why you don't see a lot of grandmothers getting pregnant or women close to menopause getting pregnant anymore. So beyond the age of 32, actually to be realistic, around 35 is sort of like the benchmark I would give. Beyond the age of 35, it starts to get more difficult. It starts to get more difficult to get pregnant.
Okay, sorry, Doc. We have a last question from
Okay.
Jenny. If you have allergies to the mineral nickel, is it safe to take magnesium and other mineral supplements?
Generally, yes. If you have an allergy to nickel, you might have already an excessive nickel load. So you might want to consider testing for your nickel levels. I've seen this happen in a few patients of mine where their heavy metal levels are actually quite high. So even a small amount of nickel may actually push you over and cause some side effects. So I would advise you to actually take a test, take a heavy metal test that includes nickel as part of the panel, so that you can see where you are in that.
Thank you, Dr. Stan. I think we have more questions left, but I'm afraid we're running out of time. We will be replying to your queries after the webinar through your Facebook messengers. As, an, as a special ode to women and with Mother's Day coming up, we are giving a free gift for minimum purchase in our online store. Tomorrow is the last day, so order now and give that special woman in your life the gift of great health. For any follow up questions that you may have, or for those who want to schedule a one on one online consultation with Dr. or any of our in house doctors, drop us a line through our Facebook or Instagram page, or you may also contact our hotline number 0917 866 2689. Again, that's 0917 866 2689. Again, happy Mother's Day to all the moms out there, and we look forward to seeing you in our next webinar.
Thank you, Pat.
Thank you, Daxtan.